Nigeria will receive the first batch of 3.9 million Oxford Astrazeneca vaccines from the World Health Organization's COVAX initiative. Officials say this first phase will see healthcare workers across the country prioritized alongside key strategy leaders. Now being joined by our correspondent Amaka Ude, who is on the ground to give us an update. Amaka, good morning to you. Thank you so much for joining us. So what is the latest where you are? Have the vaccines, have they touched down? Has the eagle landed?
Well, not just yet, Rotas. Good morning to you and good morning to everyone watching. The truth is, we were actually expecting the vaccines to touch down at about 11:10 a.m. this morning. But we have been informed by the authorities here that there has been a 1-hour delay. So we're expecting the vaccines to actually touch down here at the Nnamdi Azikiwe International Airport at exactly 12:10 p.m. this afternoon, right here in Abuja.
Great stuff. And Amaka, what about the safety precautions to ensure that the vaccines, there's no leaks and everything goes as planned? What's the security presence looking like where you are?
Well, Rotis, I can tell you that Nigeria is really ready for these vaccines to really come in here because from the information garnered, we have been told that all vaccines that come into Nigeria will have to come through the Abuja International Airport, and they will be flown to other states that have an airport with chartered flights. And of course, when they do get to states where probably they don't have an airport, there will be armored vehicles that is fitted with refrigerators to ensure that these vaccines are safe. We do know that vaccines all across the world right now is actually an essential commodity, and there is a chance that if not protected properly, hoodlums might take advantage of it, because right now, even before the vaccines arrive here in Nigeria, there's already talks of the black market. And of course, the government of Nigeria is making sure that not just this first phase of the vaccines that are coming, but every single vaccines that are coming to the country are protected to ensure that they get to the right people. And like you have said, these vaccines, even though they touched down today, we're not expected to see a rollout of these vaccines until Friday or Saturday, because NAFDAC will probably have to take a few days to really study these vaccines. Yes, they have had time in the past to study the dossiers, but some of the vaccine samples will be given to NAFDAC to, really look at it and ensure that the dossier that was submitted and the vaccine that coming to the country are of the same quality, to ensure that it's efficacious enough and, of course, it's effective to protect Nigerians against the infectious COVID-19.
Very necessary, very, very necessary protocols there. Amaka, we can't talk about vaccine delivery in Nigeria without talking about the coalition against COVID-19, the CACOVID, and their contributions. Did they in fact provide a plane for this delivery of these vaccines to be made here today?
Yeah, from what we have gathered so far, all of the vaccines, both the ones that arrive here at the Nnamdi Azikiwe International Airport and the ones that will eventually transport these vaccines from here in Abuja to other states across the Federation, the chartered planes have been provided by the private sector initiative, the CACOVID, like you have mentioned. We do know that they have been quite instrumental in ensuring that Nigeria is protected against COVID-19. Beyond even the chartered planes right now, we have been told that at least 1 million doses of COVID-19 vaccines have been purchased by the initiative. But of course, they are saying they're working towards even expanding it to get beyond the 1 million that has already been purchased by that group. But it just shows us that, when it has to come to do with this pandemic, we're seeing both the private sector, the government, and individuals all across the country really coming together just to ensure that Nigerians are protected and safe from this virus.
Indeed, very, very true. The contributions of the private sector are very important. I see we're panning around the airport there at Nnamdi Azikiwe. Amaka, so everything gets housed and stays in Abuja, yes, before distribution across the rest of the country. Is that what's the protocol? After NAFDAC, of course, does their checks. Is Abuja going to be the distribution center through which the vaccines are channeled through the rest of the country?
Please. Rotis, before I answer that question right now, we have just been giving a breaking news that the plane that is bringing the 3.9 million Oxford Astrazeneca vaccines from the COVAX initiative has just touched down here at the Nnamdi Azikiwe International Airport. And this is an exclusive unauthorized news because there's no any other media house that is covering this live. Others are just getting shot, but we can tell you that that is the plane that is currently taxiing right now. So the vaccines are here, and of course we'll get more information as to, the distribution and and all of that. But back to your question that you had asked earlier about if Abuja will be the distribution center, the answer to that question is no, because we have been told by the executive director of the Primary Healthcare Development Agency that the vaccines, they will be prioritized to frontline workers, first of all, and to some strategic leadership, including President Muhammadu Buhari, the Vice President, the Senate President, and others as well. But for now, we do know that when the strategic leadership eventually get vaccinated, from Abuja here, these vaccines will be transported via chartered plane provided by CACOVID, the private sector initiative, to other states that have got airports. And from then on, we'll have them transported in the refrigeration vehicles to other states that have no airports. And of course, it will take us straight to the local governments to ensure that everyone who deserves to get vaccinated in this first phase, let's not forget, frontline workers are the priority for this 3.9 million doses. Let's not forget, 3.9 million doses doesn't mean 3.9 people will get vaccinated. It's a two-shot vaccine, talking about the Oxford Astrazeneca vaccines. And of course, that would mean that in the 2,500 registered private care workers in Nigeria, at least 1.5 of them will get vaccinated in this first phase of this rollout of the COVID-19 vaccines in Nigeria.
Breaking news. So indeed, right behind you there, we're seeing the plane taxiing. So that's breaking news right here on our Rise TV station, our Rise News Channel Africa. Thank you, Amaka Ode, of course, on ground as we are looking at images of the plane coming into Nnamdi Azikiwe Airport in Abuja. There they are. Amaka, thanks for mentioning the fact that about the two-shot vaccine. We talked about this on the Global Business Report yesterday. Johnson & Johnson's single-shot vaccine just being approved by the U.S. FDA, the Food and Drug Administration. Do you think down the line that CACOVID, COVAX, and everybody else working on this will look at getting the single-shot Johnson & Johnson vaccines, if, of course, it gets past the approval from NAFDAC, down the line in the future, in addition to what we have from AstraZeneca and Oxford University?
Rotis, let's not forget that some time ago, I had an opportunity to chat with the DG of NAFDAC, and she actually gave us that exclusive that told us that they were not just studying only AstraZeneca vaccine dossiers. Johnson & Johnson was one of the vaccine dossiers they were studying, even though it hasn't been given the emergency use approval here in Nigeria, but they are studying it. And of course, for the fact that we've seen that approval in the US gives us the idea that this shots by the Johnson & Johnson, which has been seen as the game changer here, because every other vaccine requires 2 shots. This one requires just 1. I believe that here in Nigeria, we should see some of the jabs from the Johnson & Johnson really arrive here in Nigeria sometime in the future. I do know that the African Union initiative also, Johnson & Johnson is one of the vaccine options that are available to it. And by the way, Roto, just looking at your screen right now, this is the Emirates flight that has just brought the 3.9 million doses of the AstraZeneca vaccines promised to Nigeria. And of course, this is historic moment in the making here, especially as Nigeria just marked 1 full year of the first discovery of the coronavirus right here in the country just a few days ago. I'm sure sometime last year when the virus was broke out, we didn't know that this was going to be possible. But here we are, Nigeria becoming the 3rd country in West Africa, just after Ghana and Cote d'Ivoire, to really receive our own shots from the WHO COVAX initiative. About 3.9 million, the officials are confirming to us, is what is on board. And we're going to be here live watching the unboxing. And of course, even having a glimpse of that vaccines, even though you and I as journalists, as frontline journalists, we're not entitled to this first batch of these vaccines. But of course, the fact that we know that the frontline workers who for the past year have worked tirelessly 24 hours to ensure that Nigeria is safe and protected from the virus, they will get an opportunity to get the shots and be protected for themselves and their loved ones.
Well, very well said, Amaka. Indeed, it is very historic, looking at how far Nigeria has come over the last year. And as you said, a lot of credit to the frontline workers and all the help they've done in trying to keep Nigeria safe, as well as the involvement all organizations like COVID-19 and the private sector in making this happen. I'm seeing a lot of as they're getting ready to disembark, there's like wheeled trolleys behind you there. I'm guessing those what are going to transport them to the refrigerated trucks, all the wheeled infrastructure that we're seeing behind you there.
Well, Rotis, I'm really struggling to hear it because, as we do know, this is an airport and there's a lot of activities going on here. But from what you have just said, I can tell that you're asking about the plane. Yes, like I have said, that is the plane that came all the way from the Serum Institute in India to deliver our very first shot of the Oxford Astrazeneca vaccines to help Nigeria really combat COVID-19.
Fantastic stuff. Yeah, Amaka, I know you're struggling there to hear me because it's very, very loud. It is, after all, an airport tarmac. Well, I was actually asking about the wheel. I think they're trolleys. The trolleys, the items behind you that I think are supposed to move the vaccines to the trucks. Those items that are right behind you on wheels. But if you can't hear me, I totally understand. But I think that's what they're for.
Struggling to hear you. I'm just going to exit the camera view now.
Right.
So that way you can get a shot of at least the first boxes of the COVID-19 vaccine. Let's not forget, this is a World Health Organization COVAX initiative vaccines touching down on Nigerian soil for the first time. And let's not forget that these vaccines, according to the government, are coming to us free of charge. Because, of course, we are signed up to that initiative that has about 92 poor and middle-income countries, and Nigeria has been promised at least 16 million doses of these vaccines in this month of March. But of course, we're seeing the first 3.9 million. Let's just approximate that to about 4 million doses touching down here, which shows that, you know, we're going to get the remaining one eventually. But for now, this is where we are. Nigeria, for the first time, is receiving its first batch of the doses of Oxford AstraZeneca vaccines from the COVAX initiative.
Fantastic stuff. Amaka Ode there on ground at the Nnamdi Azikiwe Airport. Thank you so much. I know you're struggling to hear me, but all of Nigeria that's tuning in to watch this historic moment, we can all hear you very clearly, and we are seeing it with our very own eyes as to what's going on. As the officials there, they are heading into the plane, and they're already gone in. So we're all set up. We're watching this live as Nigeria receives their first doses, 3.9 million of the AstraZeneca Oxford University vaccine. So there's the plane, it's touched down. Again, as Amaka has told us, they're going to be carrying these doses into refrigerated trucks that are set up to make sure that they keep these vaccines at the necessary temperatures before taking them to where they are going to be secured by security forces.
Rotis, I don't know if you can hear me.
Yes, yeah, go ahead, Amaka.
Well, I've been able to get the UNICEF representative to talk to us quickly.
Okay.
We do know that UNICEF has been part of this initiative to ensure that Nigerians get vaccinated and on time as well. And I do have the UNICEF representative who actually joins me now to talk about this historic moment of the fact that Nigeria, we're seeing the very first dose of the AstraZeneca vaccines really touch down here in the country. Good morning, sir.
Good morning.
Let's get to meet you. Let's talk to the camera right now.
Thank you. No, as you said, it's a fantastic day for Nigeria. 4 million vaccines, or just under 4 million vaccines, have just arrived. But it's a small step in a much bigger issue that we have to address globally and here in Nigeria. This is 4 million out of roughly 280 million doses that will be required in the longer term. But this is a very good, a very positive first step. So let's celebrate this. But in the meantime, continue to take protective measures, keep wearing our mask, socially distancing, and washing our hands, and making sure we protect ourselves to protect our families and protect our communities. But this will help us in the long term.
Absolutely. But I do know that UNICEF had given a warning to Nigeria that we should not let our guard down, that even though the vaccines are coming, and you guaranteed that the vaccines were coming, and they are right here, right now. These vaccines that are coming in, what would you like to see in terms of who should get the very first doses?
Well, the very first doses will be for the frontline health workers. Those are the people most critically in need, not only to be able to do their work to protect themselves, but also to make sure that they are out there in the front line to be able to not only administer the vaccine, but continue continue the life-saving work that they do for vaccinating children, nutrition, and so on and so forth, that is so important in this country.
All right, UNICEF representative right here in Nigeria. We're going to catch up with you much later. I know you have a lot of thoughts, especially about education in Nigeria, but of course, right now it's all about this historic moment. The fact that Nigeria has just received her very first shots of the COVID-19 vaccine. Thank you so much, the UNICEF representative. And of course, here we're live at the Nnamdi Azikiwe International Airport. Let's not forget, moving forward, it has been made illegal for anybody to import COVID-19 vaccines into the country without passing through the Nnamdi Azikiwe International Airport. That was made clear by the Presidential Task Force on COVID-19. And here we are at this historic moment where the very first batch is touching down, and right now we're seeing the executives, especially the chairman of the Presidential Task Force. He's about to go unveil the vaccines, as we have just confirmed to you that they have touched down here at the Nnamdi Azikiwe International Airport en route an Emirates airline Boeing 777-300ER plane. And of course, Arise News right here giving you the exclusive and speaking to all of the officials in charge to get all the first-hand exclusive for you as Nigeria celebrates the first doses of the COVID-19 vaccines arrival in the nation's capital, Abuja.
Great stuff. Amaka, you're doing fantastic work there. You got there so early. You got there before all the officials. Arise News has been at that airport for a good long while getting ready for this, and this is an exclusive that we're getting right now. Amaka, can you hear me right now?
I definitely can hear you. Okay. That's what we do at Arise News. We ensure that Nigerians get the news as they break.
Exactly.
And right now, like we have told you, the officials from the Presidential Task Force are live here now. And of course, we're going to probably get the chairman of the Presidential Task Force, who is also the secretary to the government of the Federation, Boss Mustafa, to really talk to us about what this moment really means to Nigerians, not just even Nigerians right now, but the world over. The fact that the most populous nation in Africa finally we're getting our own first shots of the COVID-19 vaccines. So we're going to go live now and talk to the executives as soon as we get the opportunity to do that. But of course, you can watch the live pictures of what is happening live here at the Nnamdi Azikiwe International Airport, right here in the nation's capital, Abuja.
Indeed, I think I recognize the Minister of Health, Mr. Ohanire. I think I recognize Lai Mohammed as well. They're all wearing their masks, so a little hard to tell. But I believe, yes, you're correct. Boss Mustafa as well. He's pretty tall, so there he is on the left. Yes, you're correct. Those are all the officials that are there right now, Amaka, as we speak, that have gathered for this very, very historic moment.
Absolutely. Of course, we do know that even though these vaccines have arrived in our shores, that doesn't mean that it's a silver bullet. All the right precautions still have to be put in place in terms of making sure that we're protected, wearing our face mask, washing our hands, just protecting ourselves and just protecting our loved ones around us, really. So even though the vaccines are here, we're definitely not letting our guard down, because if you can look at the leadership here, they're leading by example, showing us that the truth is, even though these vaccines are here, we still have to take the right precautions to protect ourselves and our loved ones. And the minute I can get an opportunity to speak to the officials, I would definitely get that for you. But for now, it's like they're just observing the fact that the plane has finally arrived, while they are yet to speak on this historic moment here.
Thank you so much, Amaka Ode, on ground for this historic moment, as of course Nigeria's officials are now on ground taking all this historic moment in. There it is again. There's the plane for all to see that's bringing in those 3.9 million Astrazeneca Oxford University vaccines into the country. I'm joined now by Adesua Omorua. Adesua, of course, our correspondent, also giving us all our COVID-19 updates on a daily basis. Adesua, what do you make of what we are seeing? You previewed this for us on the morning show, right?
Indeed.
Yeah.
Phenomenal. Amaka has said it all. It's truly a historic moment for a country such as Nigeria and for the continent of Africa, given that Nigeria has the most population. Nigeria also happens to be one of those most affected countries when you look at top 10 countries perhaps affected on the continent, although South Africa takes it all. 3.92 million doses are supposed to have arrived on that Emirates plane.
There they are, yes, we're looking at them right now. Yeah.
And what does that mean? That means if you divide that by 2, we're getting over 1.95 million
Yes.
people who will be vaccinated. And who are these people? We've been told there will be frontline healthcare workers. So there's a distinction. Not all healthcare workers will be getting these vaccines.
Right.
The frontline health workers, those are the ones in the isolation centers, the ones who are attending to COVID-19 patients in the country at the moment. And we'll also be seeing support staff. So who are those? The lab technicians, those who empty the trash in the isolation centers, the drivers who are taking the ambulances that pick up these COVID-19 patients. So those support staff. We've even been told that additional to that would be the oil and gas, the petrol gas stations, the security personnel in the country, first responders. They will also be, in the first phase of this COVID-19 vaccinations. Then we would see what we term.
Those are some of the doses right now. I think that's onto the left of our screen. Yep, they're bringing them in. There they are, ladies and gentlemen. All packaged. Yep, those are the doses, and we can see everyone in the media representatives there. Yes, go ahead, Amaka. Yes.
Well, I don't know if you can hear me, but I know that you can watch what is going on. Here's history in the making. The very first jabs of the Oxford Astrazeneca vaccines have just been handed over to the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa. He's actually been flanked by the Executive Director of the Primary Healthcare Development Agency, that's Mr. Faisal. Of course, we do have ministers, the DG of the Nigerian Center for Disease Control. Everyone is on hand here to really welcome these vaccines. As we see this historic moment in the making. But let's not forget, we have been warned by the officials that despite the fact that these vaccines have arrived here, it's not going to cover the number of people that we needed to. This is just a drop in the ocean as to what we need to really vaccinate the 70% of Nigeria's population, which is the target of the government. But that would take us a period of about 2 years for that to happen. But of course, look at the chairman of the Presidential Task Force on COVID-19, who has actually championed, the fight against this pandemic from the beginning, alongside the members of the PTF, done a stellar work. Because let's not forget, we saw the predictions before the COVID-19 virus actually entered Nigeria. But we've seen so far, yes, over 1,900 lives have been lost so far. But I do know that this is not what the predictions were saying. Let's not forget, we do have a weak health system before we went into this pandemic. But here we are right now, 1 year after Nigeria receives her first jabs of the Oxford Astrazeneca vaccines right here at the Nnamdi Azikiwe International Airport in Nigeria's capital, Abuja.
Thank you so much, Amaka. I really appreciate the insights you're providing there as we see these historic images coming in live on Arise News. There, as you said, Boss Mustafa is there taking that in. You can see all the members of the media taking pictures of of the doses. Adesua, Amaka was talking to a member or a UNICEF representative, and he said that as big as this moment is, he still reminded everybody to continue social distancing, continue wearing your masks, and continue to try at least to keep things, don't escalate things, even though we should be very happy and very celebratory that we're seeing these vaccines coming in. So it's very important to still keep the safety protocols executed for every Nigerian.
Let me put it simply, Rotus. Is to act as though you have not been vaccinated,
right,
even though you get the jab.
Right.
And that's because the vaccines we have so far, although they prevent illnesses, they do not prevent so much infections.
Of National Primary Healthcare Development Agency, which is the lead
coronavirus disease.
Okay, let's listen to Boss Mustafa.
Vaccines and vaccination in this country. Other heads of MDS here present. I take this opportunity on behalf of the President of the Federal Republic of Nigeria to take delivery of the 3,924,000 doses of the Oxford Astrazeneca vaccines, which is part of the supplies we are receiving from the COVAX facility from Mumbai, India, which arrived this morning. I want to take this opportunity to express the gratitude of the government and people of Nigeria to the coordinating efforts of the WHO, Gavi, and CP, who facilitated the procurement and the delivery of this quantity of vaccines. As a symbolic gesture of our responsibility as the Presidential Task Force, I hereby hand over this one pallet, which is part of several other pallets that are going to be offloaded, to the Honorable Minister of Health, Dr. Osagi Ehanire, who has the sole responsibility of ensuring that due processes are followed and our legislative requirements are fulfilled, to now take over from me. Doctor, this is your consignment now. Thank you.
Thank you very much, Secretary to the Government and Chair of the Presidential Task Force on COVID-19. It is with a sense of relief and elation that we receive this consignment of vaccines, nearly 4 million in number, to begin the process of inoculating Nigerians against the deadly coronavirus disease. We have waited long for it, and I am happy that it has now been reached Nigeria, officially handed over to the government, represented by Secretary to the Government, and now to the Ministry of Health. It is our belief that this is the beginning of our journey towards eliminating the COVID-19 from our country. We assure you that the due process will be done. There will be equitable use and also free distribution, application to all parts of the country according to the protocol that has been worked out, following the guidance of the World Health Organization. This consignment will first of all be examined by NAFDAC, National Agency for Food and Drug Administration and Control. And after that, before it is handed over to the Executive Director of the National Primary Healthcare Development Agency, whose duty it will be to ensure that it goes to all the zones and from all the zones to the various states for application. A symbolic use of this vaccine will follow in some days' time when it has been cleared by NAFDAC, which I'm sure all of you here will be invited to follow. Honorable Ministers, Executive Director, NPACDA, representatives of all others here present, Excellencies, ambassadors here present, on behalf of the Ministry of Health, we want to thank you all for seeing that this has become real today. Thank you very much for listening.
Hand it over to NAFDAC.
And I'm now
NAFDAC.
I'm now going to hand this over to NAFDAC to take over and certify this dose for as long as it takes you.
The SGF, sir, the Honorable Minister, permit me to stand on the existing protocol. I'm here to represent the Director General of NAFDAC, and I want to inform all that we have looked at the dossier, and NAFDAC has given approval for these vaccines. We have our staff on ground now. They will take samples and send it to our lab, and very soon, in the next 1-2 days, we will give the final result of the test. So on behalf of the DG NAFDAC and entire people of NAFDAC, we want to appreciate the government for giving us the opportunity to make sure that just as we have looked at the dossier, that the quality, the safety and efficacy is okay, we will also pronounce that very soon. Thank you very much and God bless you. So on behalf of DG NAFDAC, I want to hand it back to the minister who will now officially hand it over to National Primary Healthcare Development Agency, that we will work together with them and make sure the certification is okay, as well as monitor the pharmacovigilance aspect of the drugs as we administer them. So, Honourable Minister, sir, I now hand over back the consignments to you on behalf of NAFDAC. Thank you, sir.
And thank you very much for handing it back to me. I will be handing it over to the Executive Director of NPACDA, conditional on receiving the clean bill of health from NAFDAC in 1 or 2 days, as we have said. So this handover is conditional on that activity taking place. Executive Director, NPACDA, this consignment is hereby handed to you conditionally.
We'll step back for the goodwill messages. We are so chopped here.
Yes.
Let's step back for the goodwill messages.
We have totally forgotten. Thank you.
I don't know if you guys can still hear me.
Go ahead, Amaka, we can hear you.
Hello, Lagos Studio,
Yes.
can you hear me?
Yes, Amaka, go right ahead. Go right ahead.
So we've just seen that moment where we're seeing an official handover of these vaccines. Of course, the chairman of the Presidential Task Force on COVID-19, who's actually led a group of people to ensure that Nigeria responds to the pandemic with science and, of course, looking at the history from other countries as well. So far, so good. He's actually accepted the first pallet of the COVID-19 vaccines and handed it over to the Honorable Minister of Health, Dr. Osage Ehanire. And of course, Osage Ehanire there handed it over to NAFDAC, who are actually going to do their own due diligence by studying the vaccines. Let's not forget, they had an opportunity to study the dossiers of these vaccines from the Serum Institute of India before the vaccines even arrived here on our shores. And now NAFDAC will have an opportunity to really study the samples of these vaccines. We saw the representative there. He said for 1 or 2 days, and eventually we'll get to know, what is involved in there and all the components, and if it's safe and efficacious enough for Nigerians. Then by Friday, hopefully we should see these vaccines really roll out and get to the arms of the frontline health workers, especially those ones who work in the isolation centers or in the hospitals that deal with COVID-19 patients, and before it trickles down to other healthcare workers right here in Nigeria. Plus, let's not forget the strategic leadership, including the chairman of the Presidential Task Force, even to the president, the chairman of the president of the Senate, as well as other key strategic leadership. They should get the jabs on their arms in the next coming days.
Great stuff, Amaka. Thank you so much for the ongoing updates. And there are the live images as we see more of the pallets coming off that flight that has touched down, as more of these vaccines are being delivered. And there they are, touching down there, going to be distributed. Adesoa, I mean, we've from Boss Mustafa, Secretary to the Government of the Federation, to Dr. Osage Ehanire, Minister of Health, to the representation of the Director General of NAFDAC, that's Mojisola Adeyeye, over to the Executive Director of the NPHDA, National Primary Healthcare Development Agency. I think it really shows the significance of this moment that we've got all these officials here on ground, and the amount of eyes that are going to be on the distribution of the vaccines and hopefully getting more for the nation. So again, I guess it emphasizes the gravity of the moment for the nation.
Formalities, but very necessary formalities. Rotus, as we see it, yes. As with this pandemic, a very important component that a lot of countries are learning, some are learning the hard way, is the component of transparency. And that's very important, from injections to variant. That's whether you have vaccines or you're having the virus. Transparency is very important. So what this again helps to prove is that the vaccines are here. And we are following due procedure. We are following due process. Now, the agencies that have received this and those who have been represented are very key. NAFDAC, like Amaka has said, received the dossier. February 15th, you recall that the World Health Organization had actually listed and approved the Oxford Astrazeneca for use, emergency use in countries. Yes. A lot of countries also depend on what the WHO do for those who don't have the capacity and infrastructure to actually carry out in-depth analysis of these vaccines. So once the WHO has done that, they've done majority of the work for you. But then countries still take the step further to do it, locally. So now that, the government has received this, it has gone through the agencies in this formality that we've just seen. The NPHCDA is the primary agency responsible for immunization in Nigeria. So they are very critical. They are at the center of this. NAFDAC will be telling us, like Amaka again has said, how efficacious is this vaccine. what are the components it needs? Although the dossier, which the Professor Adeyeye, the DG of NAFDAC, had reeled out to us last week or 2 weeks ago, had already listed that this was efficacious enough against the variants that we have. Again, those who are skeptical about this particular vaccine that we're receiving, which makes up the majority of the COVAX initiative vaccines of the 900 million doses that will be made, that will be secured, because South Africa rejected it to opt for Johnson & Johnson, can again be reassured that due process is being done. So this is fantastic. These are steps that were necessary to be taken and for all to see.
Fantastic stuff. I take it you're going to be continuing this conversation
Definitely.
on Newsday?
Indeed.
Yeah, in a few minutes? All right. Look, Amaka Ude on ground. Thank you so excellent work from Amaka. But of course, Adeso Amora with me here in the studio. Again, dear Nigeria, that is exclusive images of the arrival of the Astrazeneca vaccines, 3.9 million doses. We've heard from government officials that have received them. And of course, we're going to be talking a lot about the distribution of the vaccines. But again, credits to COVID-19 and their involvement in getting this here. And of course, we pledge again our support to all the frontline workers that will be getting doses of these vaccines. That's going to do it for the Global Business Report. Do stay tuned to Arise News from all of us. Thank you so much for watching.